Let's talk about nursing care for hepatitis. First and foremost, it's important that the client rest. The liver has a tremendous power to regenerate, but it needs good nutrition and it needs rest. Again, the patient, because of the mode of transmission or depending on the mode of transmission, will be on contact and standard precautions. The type of diet, again, we said nutrition is very important. The patient will be on a low-fat, high-calorie, high-protein diet, and that's needed for organ healing. Patients with hepatitis, alcoholic beverages are prohibited. And there are several medications the patient will take. Again, you might say, well, wait a minute, doesn't the liver detoxify medications? Well, yes, it does. So you would limit the number of medications, or hopefully the number of medications the patient would be taking would be limited, but there are some that are used. For example, vitamin K or aquamaphytin would be used if the patient experiences bleeding problems. Many times the patients suffer from nausea and vomiting, so an antiemetic would be used. They don't use compazine, but they might use Tigan or Dramamine. Many times they will use corticosteroids to decrease the inflammation or inflammatory response, or antihistamines. And again, if they use antihistamines, they're more likely to be ointments, lotions, or baths than something that's taken systemically. The next infection we're going to talk about is Lyme's disease. Now, Lyme's disease is a multi-system infection caused by a tick bite. And there are 3 stages to Lyme's disease. Stage 1 is where there is an erythematosus papule that develops into a lesion with a clear center, or a bullseye. Essentially, that means there's a reddened area that's raised. It's a papule that has a clear center, and again, a bullseye is a very good description of this. This usually will develop at the site of the bite from the tick between 2 and 30 days, and after time, concentric rings or rings around it will develop, again, which makes it look very much like a bullseye. Patients with stage 1 Lyme disease many times suffer from regional lymphadenopathy, and they may complain of flu-like symptoms such as fever, headache, or conjunctivitis. Now, stage 1 in these type of symptoms can develop over 1 to several months. Stage 2 Lyme's disease, this will develop after 1 to 6 months if the disease is untreated. And the problem is that many times individuals are unsure or don't know that they have been bit by the tick, so they don't even know that there's a problem. They just know that they don't feel good and they've got flu and something is going on. And many times this disease is picked up during stage 2 because of the cardiac conduction defects. There was a situation in the hospital where a patient presented with a pulse of about 45, again, with stage 2 Lyme's disease, and yes, he had gone hiking in the woods 2 months previously. They may also suffer in stage 2 of neurological disorders such as Bell's palsy, with a type of temporary paralysis. With stage 3, they will complain of arthralgias, and they will have enlarged, inflamed joints. Again, stage 3 develops, between 1 and several months. The problem with stage 3, if it gets that far, is it may persist for several years. Now, Lyme's disease, the best way to deal with it is not to have to deal with it, which is to prevent it. So one of the teaching you want to do for patients or individuals who hike and climb and rappel and that type of thing is to cover any exposed areas when they're in wooded areas and exposed areas on their body. They should wear a long sleeve shirt and long pants and cover areas where ticks may come in. And then after they come in from the woods into the camp, that type of thing, they should check all exposed areas and around waistbands and all for the presence of ticks. Again, nursing care for Lyme's disease, once it has been diagnosed, is the patient will be put on a course of antibiotics for 3 to 4 weeks. Many times with stage 1, they will use doxycycline with an IV penicillin with some of the later stages. Let's talk about sexually transmitted diseases, or STDs. There's several different types of sexually transmitted diseases, and it is important that you know the differences. This is a frequently tested topic on the NCLEX. Let's talk first about syphilis. What you'll see with syphilis is a painless canker that fades after about 6 weeks. The patient may also have a low-grade fever and may have a copper-colored rash on the palms of their hands and the soles of their feet. Syphilis is spread by contact with mucous membranes, and it also is spread congenitally. It's treated with penicillin GIM, and If the patient has a penicillin allergy, they will use erythromycin for 10 to 15 days. And the important thing with treatment of syphilis is after the course of treatment, the patient should be retested to make sure that they've been cured, that the disease has gone away. Let's talk next about gonorrhea. With gonorrhea if you're a female, you may be totally asymptomatic and be unaware that you have the disease. More likely with males, they will have a thick discharge from the urethra. Some females, again, have a thick discharge from the vagina. This disease is also spread by contact with mucous membranes and is also spread congenitally. The type of treatment they use for gonorrhea is IM Rocephin and doxycycline PO. They also can use IM aqueous penicillin, and when they do that, usually combine it with PO probenecid. You remember probenecid is a medication used for gout, and the reason they use it with the IM aqueous penicillin is it delays the urinary excretion of the penicillin, so it makes the medication, the penicillin, more effective. Now, a complication of untreated gonorrhea is PID, or pelvic inflammatory disease. Now, many times with gonorrhea, they have a concomitant infection with chlamydia. In about 45% of the cases, again, they're infected with chlamydia. And in that case, they'll use PO tetracycline. The next sexually transmitted disease we'll talk about is genital herpes. Now, with genital herpes, there is no cure, and usually the patient will present with painful vesicular lesions in the genital area. A problem with genital herpes is there are exacerbations and remissions, and the disease will reoccur with stress, infection, and at the time of a woman's menses. Again, this sexually transmitted disease is spread by contact with mucous membranes and also congenitally. The treatment for this, again, remember there's no cure, but the treatment, they use acyclovir and they use sitz baths. Now, with genital herpes, there is a higher incidence than usual of cervical cancer, so they need very frequent pap smears to evaluate for that. With genital herpes, because there is no cure, again, emotional support for the client and significant others are very important. Now, if a person or a woman with genital herpes is going to deliver a child, because it can spread congenitally, if the woman has active disease, they will perform a C-section. The next sexually transmitted disease is chlamydia. In men, they will have urethritis and dysuria. Women will experience a thick vaginal discharge with an acrid odor. Again, this sexually transmitted disease is spread by contact with mucous membranes. The type of treatment they use is tetracycline or doxycycline PO, and this disease may cause sterility if left untreated. Again, with this disease and all the sexually transmitted diseases, it's very important to notify the sexual contacts so they can come in and be tested. The last sexually transmitted disease we're going to talk about is venereal warts. Venereal warts are small papillary lesions that spread into large kind of cauliflower clusters on the perineum, vaginal, or penis. Again, papillary is a raised area. They also may itch or burn. Venereal warts are spread by contact with mucous membranes and also congenitally. The type of treatment they use for venereal warts are curettage and cryotherapy, or burning or removing with liquid nitrogen. They also use keratolytic agents to remove them. Now, when the patient has venereal warts, you want to avoid intimate contact until the lesions are healed. And there is a strong association of venereal warts with genital dysplasia and cancer. So it's very important that these individuals have frequent checkups with the medical community. Again, it's important to notify sexual contacts. Let's move on from sexually transmitted disease and talk about both AIDS and HIV positive patients. Now, there's a difference between AIDS and HIV positive, and let's talk about that for just a minute. A patient is HIV positive when they have the HIV virus present in their blood. And that's it. If you're HIV positive, you have the virus present in your blood. Now, AIDS is a little bit more than that. When you talk about AIDS, it is where there are significant defects in the immune function. It is associated with the HIV virus, and it is evidenced by development of what they call opportunistic infections. So again, AIDS, there are significant defects in immune function, and it is associated with the HIV virus, but it is evidenced by opportunistic infections. It's a syndrome where the CD4 counts are usually